one-shot vaccine, and it has been found safe to be used in the prevention of the coronavirus disease, or otherwise known as COVID-19. It's a one-dose vaccine, so if you don't like needles, or if there are issues with availability, with your ability to get to a vaccination site, to take time away from family or work, this may be a good solution for you as well. For health systems, the vaccine is easier to transport, easier to handle, and it's easier to bring the vaccine to the individual rather than having the individual come to the vaccine for rural areas, or again, areas for populations where transportation and time away are going to be a little bit more difficult. For women younger than age 50, we are going to be following the CDC guideline and letting these women know that there is a slightly increased risk for unusual clotting disorders. This risk is very small, yet we will be advising our patients of this risk and letting them choose, in consultation with their healthcare provider, which vaccine is best for them. We do strongly encourage all of our community to be vaccinated. That will help us to be able to get past the pandemic and get back to our normal activities as quickly as possible, and that we as a community can move forward and put this pandemic eventually behind us. Again, we're happy to answer any questions, and thank you for your time.
And just be sure to put your questions in the chat feature for us. I'm going to throw out a question, and this isn't specific to J&J. Dr. Pavia, this is a question for you. Yesterday, news came out that up to about 5 million Americans have received their first vaccine, but not their second yet, and they're late. So it's an indicator that maybe they're waiting or maybe a bit reluctant to get their second dose. Can you comment on that, and how important is it that people follow up if they're getting Pfizer or Moderna? How important is it that they get that second dose?
Well, the second shot is really important to develop that deep and lasting immunity that will protect you against not just the the older strains, but against the variants. We don't really know why people have been slow to come in and get their second shot. I suspect a lot of it is that life has interfered. They missed their appointment, and then they didn't want to go through the trouble of rescheduling. I do want to urge anyone who only got their first dose to come on in and get their second dose, because it's very important. The one exception may be people who had COVID-19 recently, because we know that that acts as a prime, is somewhat like the initial dose of vaccine, and they get a very good response to one dose of vaccine. That's not the official recommendation. But if you never had COVID-19, you really need to get both doses.
And how effective are all of our vaccines, Johnson & Johnson, Pfizer, and Moderna, against all the variants that we're seeing right now? Dr. Pavia, do you want to take that?
Yeah, so all of our vaccines provide pretty high level of protection against all of the variants. We probably lose some of the efficacy that is there, not probably functioning at that 90 to 95% level of protection that we saw, which, let me remind you, is just extraordinary. There are very few vaccines that are 95% effective. What's really important is that the vaccines seem to protect better against variants than natural infection does. That is, people who've been infected with COVID-19 several months ago are at risk of getting infected with these new variants and with getting quite ill with them. And we're seeing that play out the world and throughout the country. We're seeing large surges in places like Brazil and India that are driven in part by the variants. And we're seeing local outbreaks, including some here in Utah, that seem to be related to the variants. So vaccines are your best line of protection against the variants, but it also means, because these are spread more easily, and your chance of getting infected has gone back up with basically the replacement of the old strains with variants, that now's the time to get vaccinated. You don't want to wait.
Dr. Orlandi, talk us through the process of making this decision to pause on the J&J vaccine and to restart it again. What did we as an institution, what kind of thought process and leadership decisions went into that?
We're blessed to have a terrific cadre of very intelligent infectious disease and epidemiology experts, and we're following all of these recommendations very closely. And when the FDA and CDC recommended a pause and the state of Utah went along with that recommendation, our State Department of Health, we of course did as well. We've been looking at the data, analyzing it in tandem as the FDA and CDC have. And it's clear there is a risk, and so pausing, I think, was the right thing to do to make sure that we can be absolutely sure that we can be certain that these vaccines are as safe as we think they are, and they are proving to be. Nothing is without risks, but as we balance that decision to go back and resume using the Johnson & Johnson vaccine, we're balancing the risk of getting COVID, of being in the hospital, of becoming very ill or even dying of COVID. That's not an insignificant risk, and it's much higher a risk than some of these even rarer complications from the vaccine itself. So with any medical intervention, with any drug that we give, there's always pluses and minuses that any physician, any healthcare provider will balance. In this case, with the Johnson & Johnson vaccine, the benefit of the vaccine far outweigh the risks, but we wanted to be respectful and cautious to make sure that was the case. The CDC, the FDA, and others have done that great work to make sure that it's safe, and we're pleased to lift the pause and resume.
So you're leading our vaccine distribution efforts here at U of U Health. I'm going to ask you, like, would you be confident giving the J&J vaccine to a member of your own family?
I would be absolutely confident with a family member, a loved one receiving the J&J vaccine. My closest family members have received the J&J vaccine, and I would be very confident in any loved one continuing in the future to receive the J&J vaccine. It is safe. It is not 100% safe. No activity in life is, but the J&J vaccine will prevent serious complications of COVID. It can drastically reduce hospitalization and serious illness. And in balancing the risks and benefits, the J&J vaccine is still a good idea.
And Dr. Pavia, same question for you. Would you recommend it for members of your own family?
Without question. I would want any younger woman in my family to know that there is this a very small risk. And I'll talk for a second about what that risk really looks like, and make sure that she was balancing her choice between getting 2 shots and 1 shot against this very small risk. So for younger women, the group at the highest risk, the CDC estimates that they're going to be about 7 clots per million. Now that we've informed physicians about how to recognize and treat these, we hope that there won't be any deaths associated with that. So think about 7 per million and compare that to the risk of severe blood clots in the brain during a pregnancy. That's about 40 times higher, 40 to maybe as much as 100 times higher. With oral contraceptives, it's 30 to 40 times higher. So 7 in a million sounds like a lot. We don't think about numbers. We think about how we feel about risk. But how many of you are scared to get in your car this afternoon? 1 out of 800 and out of 8,600 Utahns will die this year in a car accident. Compare that to 7 in a million. So it is a very small risk, one we really want people to be aware of and to be totally transparent about, but it is really remarkably rare.
And Dr. Pavia, another question for you. This pause has probably without question created some doubt in some people's minds about the vaccine, but you were talking to us earlier before this press conference began and talking about the CDC's decision to do this. Why did they make this decision to put this pause?
Yeah. We treat vaccines with the most care in terms of looking for any safety signal, very much like we do air safety. And I think many people criticize the pause and said, if it wasn't that big a deal, why did you pause? But the way I think about this is that if you're a pilot and you're about to take a jet with 300 people on board and one single light on your cockpit is not correct, you go back to the gate and you check it out. And that's the approach that we take with vaccines. And we also really wanted to know if this risk was real, how big is it? So the pause scared a lot of people. It's hard not to take that as something that is a little bit scary, but it really was the right thing to do and the only thing to do, even if from a sort of emotional point of view, it felt wrong.
Okay, Dr. Orlandi, in your opinion, why does the Hispanic community have a lower percentage of people who are getting fully vaccinated in our state? Is this about access? Is it about doses? Is it about just mistrust? What would you say?
The reason that any group may have lower vaccination rates compared to others is very complicated. There are multiple reasons, all interacting with one another. There are issues of trust in people outside of your community, and there's history with medical procedures and medical interventions in the past and research that in some cases may impact that trust for very real reasons. There are issues with language barriers, with understanding barriers. There are cultural implications of why one group or another may be more likely to get a vaccine. I think our government and our county and our state has done a great job, and as well as health systems, in partnering to make sure that vaccines are accessible in locations throughout our communities. But there are multiple challenges, and I think it teaches us a lot about healthcare in general and the disparities that we see that underlie that, and we're seeing that definitely with COVID and with the vaccination effort.
I'm going to throw out a question to both of you. What advice do you have for people who may have family members who are reluctant to get vaccinated? We're hearing that might be a little more prevalent in younger age groups, but yet these are adults, maybe young adult children or that sort of thing. What advice do you have to try and move people toward getting vaccinated? I'll start with you, Dr. Orlandi. Go ahead, Dr. Pavia.
Sure, doesn't matter. We have to remember that people are often more motivated by incentives than they are by fear. And that's particularly true for young people, because when we're younger, we're invulnerable. We're never going to be that one 25-year-old who dies of COVID. But there are a lot of advantages to being vaccinated. You will be able to do more things. You'll be able to safely interact with people who are vulnerable, whose vaccine may not have worked, which we know that the elderly and people on many medicines don't have terrific protection. You will be allowed to work in certain jobs where vaccination is going to be required. And you can just feel safe that you're not going to end up with some of those very life-changing long-term complications that have nothing to do with being hospitalized or going to an ICU. The heart damage, the prolonged fatigue, the brain fog and memory difficulties that can really be life-altering even for a young person. So people really need to think about the benefits as much as the risks. And then I think a lot of people just really want to understand the safety, and they want to hear it from people they trust. And for many people, the people they trust are not the government, even though they're doing a terrific job with the science. They may not even be people like Dr. Orlandi and I wearing white coats. It may be they want to hear it from their own family doctor or from family members.
I think Dr. Pavia makes some great points. If I may add, in addition, as a nasal and sinus surgeon, what I talk to a lot of patients about is the change in the sense of smell and taste that can occur with COVID and can last. And we don't know how long that can last, but we're seeing that in quite a few patients. I think the other reason for a young person who feels immortal, as Dr. Pavia has said, to get the COVID vaccine is really to benefit others. That person, yes, arguably is at much lower risk of hospitalization or severe disease, not at zero risk, but at a lower risk. But they could transmit the disease to someone else who may have an impaired immune system, who may not have had as robust a response to the vaccine as normal, who may not have been able to get a vaccine for whatever reason. And so this is a group of people, in my experience, who cares a great deal about others and about those in their community. And I would think that that would be one of the greatest motivations for them, in addition to all the great reasons that Dr. Pavia gave.
We can't end this pandemic without getting a very high rate of vaccination in this country. And that means we've all got to pull together and do it. So, you know, one of the major reasons to get vaccinated is for your community, for your friends, for the people in your church, for the country, and not just for yourself. Well, that's important too.
And can we reiterate one more time? So we expect to start opening up appointments for J&J when? Dr. Orlandi, can you review that again?
Happy to. We expect to be opening appointments within the next day or two for the Johnson & Johnson vaccine for immunizations that will take place the early part of next week at our Farmington and our South Jordan health centers. Our other health centers will continue to use the Pfizer vaccine as we have throughout this pause.
Okay. Alex, do we have any questions from Facebook?
No, no questions.
Okay, do we have any other questions from media? Any final thoughts, Dr. Pavia or Dr. Orlandi, before we close?
Well, one thing that I think I would direct anyone in the media who wants to write about this to is an article that came out from the CDC and the MMWR today. It really looked at that risk benefit, and the numbers are there. I can read them off for you, but it's easy enough to look at this article. But they estimated that by restarting the J&J vaccine, for every 10 million doses of vaccine that are given out, we're going to prevent somewhere between 600 and 1,400 deaths and between 4,000 and 10,000 hospitalizations. And at most, we might experience 26 clots. Think about that in terms of balance. That's how we make these decisions. And then at an individual level, it's the same issue. If you get COVID-19, you have a 40 times higher chance of getting a severe cerebral clot than if you get the J&J vaccine. And of course, there's a choice in what vaccine you want to get.
Dr. Orlandi, any final thoughts?
No, I think Dr. Pavia has articulated the risks quite well, and I think that's really what this is about. Every experience in life, as he said, whether you get in your car or get on a plane or do anything else or walk down the street, there are risks, and we have to balance those. And I think the CDC and the FDA and our experts here at University of Utah Health have done a great job of examining that balance, and we all feel comfortable moving forward with the J&J vaccine.
Okay, and we did get one quick question from Facebook. When will the vaccines be available for kids 12 to 15? Dr. Pavia.
Yeah, well, I can't give you an exact date. We know that Pfizer has had very good safety and immunogenicity data and has submitted it to the FDA. Moderna has said that they will submit it by the end of the month, which means in the next couple of days. And it will probably take the FDA somewhere between 4 and 8 weeks to review all that and come to a decision. So I think early summer is the best guess, but stay tuned.
Okay, in the meantime, we keep wearing our masks indoors and following social distancing, correct?
And if you're vaccinated, you can stop wearing your mask outdoors, except when you're in a crowded place.
Great. All right, if we don't have any other questions from media, we'll close it up. Any others? Going. All right, we're going to end it. Thanks, everybody. Thanks for joining us. Thank you, Dr. Pavia and Dr. Orlandi. Appreciate your time.
Thank you.